It's nice to have you join me on this week's episode of Health Business. I hope you've been taking good care of yourself. Today on the program, you have the opportunity to know who a maxillofacial surgeon is and what they do. My name is Oluwatoyin Kolawole. Stay tuned.
In view of high prevalence of maternal mortality in Osun State, the state government, in partnership with the federal government's Sustainable Development Goals, has embarked on the distribution of 12,500 pregnancy kits for pregnant women who are economically disadvantaged. While addressing health journalists in Lagos, the Osun State Commissioner for Health, Dr. Rafiu Shamotu, says the program tagged Mama Kit was personally coordinated by Governor Rauf Aregbesola in a bid to drastically reduce the high maternal mortality ratio.
We have just recently flagged off our SOML Save 1 Million Lives program for research. This was done in December 2017, and at the same time we launched Maternal, Newborn and Child Health Week, where we distributed 15,000 Mama Kit. Mama Kit is what pregnant women will need. This is what they will need when they want to deliver. We give that to pregnant women who attended the flag off. Basically, the idea is to attract our women to patronize public hospitals. It's an ongoing thing. Pregnant women in our public hospitals in Osun will get this Mama Kit. That was flagged off in December 2017.
The commissioner also used the opportunity to explain how the state has protected its people from the scourge of the rampaging Lassa fever disease, linking the success to massive surveillance, intensive enlightenment campaign, and rapid response initiatives, among others.
Healthcare services in the state is free, and in case of epidemics, we have put some measures in place, such as raising people's awareness towards any possible disease outbreaks, capacity building for our health workers. Our disease surveillance officers are always on their toes to look for any disease outbreak with adequate reports on weekly basis and on emergencies. If there's any suspected case of any disease of public importance in Osun, within 24 hours, we get notified.
Shamotu noted that isolation centers and professional protective equipment are already in place in case of emergencies.
Some weeks back, Nigeria joined the rest of the world to commemorate this year's Oral and Maxillofacial Surgery Day, with the aim to educate people on what these professionals do. Health Business was at the Lagos University Teaching Hospital and spoke with the head of the department to understand who are these professionals and what they do.
Well, I'm Olubenga Ogunlewe. I'm a consultant oral and maxillofacial surgeon with the Lagos University Teaching Hospital, and I'm also a professor of oral and maxillofacial surgery at the College of Medicine, University of Lagos. Well, maxillofacial surgeons diagnose and treat the diseases that involve the lower two-thirds of the face. Essentially, it involves the mouth and the bones of the lower jaw, the bones of the upper jaw, as well as the bones of the middle third of the face. And we also manage diseases that we call congenital diseases, those diseases that some of the children are born with, particularly cleft lip and palate. The International Day of the Oral and Maxillofacial Surgeons is actually set up by the International Association of the Oral and Maxillofacial Surgeons to create awareness on the specialty of oral and maxillofacial surgery, because it's been observed that many people all over the world do not know much about that specialty. And when they have diseases that we should treat, they actually go somewhere else, or because of the ignorance, they hide at home and they don't know what to do. And by the time they are reporting to us, usually at times, we may not be able to do much to help them. And it's also to celebrate some of our surgeons that have been of use to the society. What I will call the main challenge to the practice of oral and maxillofacial surgery, one, the very little knowledge of the specialty by our patients, and then the practice is actually, let me say, it involves a lot of technology. You require a lot of instruments, you require a lot of equipment. But thank God we are still able to do something in this country, even though we don't have all the gadgets that we require to treat the disease. But with the little that is available to us, we have been able to put smiles on the faces of many of our patients. Okay, if you divide the face into three, there is a line that goes across the mouth when you open the mouth, and draw another line across the two eyes. So the area where we focus on is essentially the lower two-thirds of the face. And if you look at that lower two-thirds of the face, you have the mouth, which referred to as the oral cavity. In the oral cavity, you have the teeth, you have the gum, you have the cheek, you have the tongue. So if you have any disease within that area, is the maxillofacial surgeon that you will see. Then on the face, if you have any, let me say, accident that involves the bones of the face, as we will show in some of the pictures, accident that involves the bones of the face is the maxillofacial surgeon that we treat. But when you look at this area of maxillofacial, the maxillofacial area, you will see that there is an overlap. The nose is there, the eye is there. So at times we need to collaborate with the ENT, we need to collaborate with the ophthalmologist, we need to collaborate with the neurosurgeons to treat some of these patients, because some of the diseases may cause across all these various specialties. For the past 10 years, the Lagos University Teaching Hospital has partnered with the SMILE Train, which is an international non-governmental organization in the United States of America. And they have actually been providing funds for us to treat patients that have cleft lip and palate. This is a congenital deformity which the baby is born with. So there is nothing you can really do about it. Once the baby is born with this, then we need to take care to correct the defects. And the organization SMILE Train has been providing funds for the surgical treatment of these patients. They have provided funds for speech therapy. They have provided funds for orthodontic treatment, because the treatment of these babies involve quite a lot of specialties. So they have actually been providing the fund for us to treat them. So if anybody, child or adult, comes to the Lagos University Teaching Hospital with cleft lip and palate, he will be treated free from day one till he leaves the hospital. If you have a swelling on this area of your jaws, or in this area of your face that I have mentioned, because the swelling at times may not be anything serious, at times it may even be a cancer. So once you notice any little swelling on your face, on this area of your face, it's advisable you see the maxillofacial surgeon. We'll be able to advise whether it's within our own specialty or within another scope. Then if you have an accident that involves your jaws, you should see the maxillofacial surgeon. If you have infections around your mouth and around your jaws, you should see the maxillofacial surgeon. If your baby is born with any defects that involves the lip, that involves the lower lip, the upper lip, and involves the roof of the mouth, you should see the maxillofacial surgeon. And we are all over the country.
time for Dr. David Ikudaisi to educate us on how regenerative medicine can manage some health conditions. Stay tuned.
Good day, viewers. Last week we were talking about regenerative medicine, and we're going to continue today as well. Today I want to mention some of the things or other things that regenerative medicine can do for you. First of all, before I go any further, for those that are watching this for the first time, regenerative medicine is a kind of a new field of medicine that helps to restore the normal functioning of the body. If there's anything that has been damaged due to age, congenital conditions, regenerative medicine can help. And I was talking about platelet-rich plasma therapy and adult stem cell therapy. Today, let's take diabetes for example. Diabetes can be type 1 or type 2. The type 1 is more common in the children and young adults, and sometimes it could be caused by autoimmune disorder, whereas type 2 is when somebody did not have diabetes and all of a sudden, maybe later during their lifetime, they develop diabetes. It could also be because of being overweight, many other conditions. I mean, it could be related to drugs, drug-induced, gestational. There are many conditions. But what is important is this. Any of the diabetes is being caused because of there's a misbalance between the insulin supply, the effectiveness of it of driving the sugar, into the in the blood stream into the muscles so that they can be used as a source of energy. This is a condition that affects many of us in Africa, and it is important that that is not the end of the world, thanks to regenerative medicine. With the understanding and the availability of adult stem cell therapy, today people can be taking off the diabetic medications, or the worst, they get to the minimal dose to address the diabetic issues they have. And to do this, we use, for the source of adult stem cell therapy, we use bone marrow. Your doctor can decide to use fat, or it could also be umbilical cord blood. These are possible sources of stem cells that can help your body to regenerate. And the way it works is that the pancreas has certain cells. The islet cells are like a unit in the pancreas that produce insulin. When the patient is treated with adult stem cell therapy, the pancreas starts repairing itself, regenerating itself, having more units to produce this insulin that is needed. And what you find out that after a while, the patient will be using lower doses of their medication, their body is able to produce more insulin, and then eventually they can get off. Mind you, there's also another component, of this problem that we call insulin resistance. That is when there's enough insulin, but the muscles are not sensitive to it. So that's why most of the patients that are overweight, they are being put on metformin by their doctors. So we found out that with help of regenerative medicine, or let me say adult stem cell therapy, we've been able to help patients get off their medications, or the worst case scenario, go down to the minimal dose of these medications. Another benefit of using regenerative medicine for diabetes is that we can prevent all the complications that are associated with diabetes. If one, and by the way, the earlier one decide to get adult stem cell therapy to address the regenerative medicine, the faster and the more effective the treatment is going to be. By doing this, you're going to prevent complications of kidney failure, the heart being affected, deficiency of blood supply to the legs leading to amputation, and and many other problems. So it is very important that you understand, if you don't want to be on medication for the rest of your life, regenerative medicine could be an option for you. So please keep that in mind. I'm Dr. David Ikudaise, a US board certified internist and regenerative medicine specialist. I will see you next week to continue on other conditions that regenerative medicine can treat. Thank you for watching, and make sure you tune in next week.
Up next is the pharmacy segment.
According to World Health Organization, 60% of the world's population depends on traditional medicine, and 80% of the population in developing countries depends almost entirely on traditional medicine practices and herbal medicines for their primary health care needs. As a result of increasing demand for herbal medicines, there are increasing concerns about the safety, standardization, efficacy, quality, availability, and preservation of herbal products by policymakers, health professionals, as well as the general public. The Nigeria Association of Industrial Pharmacists and Hospital Pharmacists unanimously agree that it is important for government to increase research funding for herbal medicine.
We've made some of these products, we've done research, no money to take it forward. Sometimes you even have little support here and there, no money to take it further and further and further than you need, further and further that is in a way you require. So if they fund it, we are going to go far.
The experts say there are enormous potentials of herbal plants, and research into identification, extraction, classification, and purification of the herbs will lead to discovery of new drugs for better treatment of many ailments bedeviling Nigerians.
Nigeria needs a deliberate research and development agenda in order to develop its phytomedicine or herbal industry. It is not doing that right now. So funding, in terms of availability of funds to do that, is not the problem. There is enough resources in Nigeria for us to develop the pharmaceutical sector, especially the herbal industry, where we have comparative advantage over the rest of the world. But because it is not an agenda, because it is not a priority of government, we are not doing that. All we need to do is to make it a priority.
The pharma industry in Nigeria, from what we have heard from economists, contribute very little to GDP, okay? And we cannot contribute meaningfully to GDP if we don't earn foreign exchange for our country. Okay, so if we are going ahead and importing starch, importing ethanol, importing paracetamol, all those raw materials, that means we are spending our hard-earned currency to buy those things. And then when we produce, it's for our local market. So what can begin to earn us money is maybe if we tap from our local resources, develop something for the world, then we can sell to the world and earn foreign exchange for Nigeria.
The pharmacists, however, maintain that with the current sustained improvements in quality control and regulatory measures in many countries of the world, it is envisaged that in the near future, herbal medicinal practices will be integrated into the conventional medicines.
Let's now join Dr. Abayomi Ajayi to educate us on causes and management of infertility on understanding infertility.
Welcome to Understanding Infertility. My name is Dr. Abayomi Ajayi, and today we're going to be discussing something very interesting: male infertility. How can we treat when the sperm parameters are not at par? We can look at this from 3 different views: drugs, surgery, and assisted conception. For the drugs, well, unfortunately, as of now, there's still no sperm boosters. So when the sperm count is really low, then drugs, as of now, cannot really help. When the sperm count is low or not there at all, the only thing that is proven to give remedy is assisted conception. And you know, the first assisted conception was what we call IVF, and that's why up to now we still call everything IVF under assisted conception. But we know that there are so many spin-offs of IVF, and one of them for male infertility is what we call ICSI, or intracytoplasmic sperm injection. What this simply means is that we just take one sperm and we inject it into one egg. This is of course done under very high magnification and requires a lot of skills from the people who are doing it, the embryologist. So this is where actually the rubber meets the road, where you need the skill of the clinic to be able to do this. From 2004, other things like IMSI, which is an advancement on ICSI, have also been introduced. What this also means is that in ICSI, what we do, you know, I told you we magnify the sperm to times 200 or times 400, but in IMSI, we actually magnify to about times 7,000. So we are able to see all the various parts of the sperm. And one frightening thing that we saw was that a lot of the sperm had holes in their heads, which are not normal sperm, which we should not use for fertilization. And that was why when we started with ICSI, we were beginning to fertilize a lot of eggs, but we were also having a lot of miscarriages because we were just simply using sperm that normally we not fertilize to fertilize the eggs. But with IMSI, we're able to pick and choose the ones that are normal and the ones that are not normal. Sometimes there's some things that you can do to prevent having low sperm count. If you have not already had it, there's some things that you can do to prevent it or to preserve your fertility as a man. But what we say most of the time is that diet, you eat healthily, make sure that you maintain a normal BMI or body mass index, not to talk of hard drugs. Excessive alcohol also depresses sperm count. Caffeine should be limited to not more than 2 cups per day. Anabolic steroids, that is the drugs that people use when they want to develop six-pack, definitely destroys the warehouse of the factory for producing semen. One other thing that people ask all the time is about this underwear, the controversy between boxers and pants. Yeah, boxers are better, no doubt, but does not mean that because you're wearing boxers you can't have male factor infertility. Like I said, the only thing is that you must do tests to find out whether there's an issue or not. I think that's what where we're going to round up today. We'll see you next time. Remember, together we can conquer infertility. My name is still Dr. Abayomi Ajayi. Catch you.
We've come to the end of this episode of Health Business. I'm sure you must have enjoyed every bit of it. For advert and sponsorship, please call the numbers showing on your screen. Remember, living healthy is a serious business. My name is Oluwatoyin Kolaole. Join me again next week. Bye for now. Thank you.